Yo, what's up guys? Today John the PT is going to be covering tennis elbow and how to treat it. This might be a lengthy video, so I'm going to put time codes so you guys can skip ahead. Alright, let's get started.
Today we're going to talk about tennis elbow. The first thing I'm going to talk about is the anatomy involved in the tennis elbow injury. If you're standing like this with your hands down at your side, the tennis elbow is involved with the outside or the lateral part of your arm. And the muscles that it usually affects the tennis elbow is the extensor muscles which are located on the back of your arm. And what happens with those is, the muscle has two attachments. It has its origin. The origin is up here in the lateral epicondyle, and then you have the insertion, which is down here in your hand. So the muscle part is here in the back of your forearm, and then the tendons run across your wrist into your hand. So the main thing that the extensor muscles do is they extend, or they bring your wrist up like that. And they're also involved in a gripping motion. So when you grip something, as you can see right here, that also stresses the extensor muscles. A lot of times when you get a tennis elbow, the tennis elbow is located in the lateral area, what I just talked about, it comes on rather slowly. It's what we call a overuse injury. You might be working with a hammer all day and you have a tight grip on the hammer and you're doing a lot of this with the hammer, flexion, extension, and a lot of movement, holding on, gripping. And then at the end of the day, you say to yourself, well, that's a little bit sore, but it's not too bad. The next day you get up and it's tight, sore, it doesn't move too well, but you pick up the hammer again, you start using that during the course of the day, and it starts to loosen up. Until finally one day when you go to pick up the hammer, it's so sore you can hardly hold the hammer. And at that point you know that you better go seek some treatment. So I don't have a tennis racket here, so I'm just going to use this baseball bat. But you can see when you're coming back like this, a tennis swing in this motion, that I'm using my extensor muscles to grip the handle, and I'm also using the muscles to hit the ball against the racket. And it's the same type of thing that I talked about with the hammer. It's an overuse injury. So initially, you might just have some minor amount of pain when you're playing tennis and you just kind of keep going, and until that one day when it's even painful for you to like pick up and grip the racket. Now usually most tennis elbow injuries respond to conservative treatment. You can arrest it, cut down on your activity level, use ice, and wear a brace. You go down about an inch from the lateral epicondyle, or the outside of his elbow, and you take the strap like so, and you move it around. Now, if it's a smaller strap, you don't have to go around as many times. And you make it fairly tight. So then, when Chris makes a fist, instead of feeling the pressure up here at the lateral epicondyle, he should feel the pressure here in the muscle belly. So it actually flattens out the muscle belly to take some of the pressure off of that elbow. Most of the pressure will start down here in the hand, and this lateral epicondyle is going to come from the tendons that run up the top of his arm. So when he squeezes, makes a muscle, when he squeezes his hand, grip strength, when he extends his wrist, and when he moves it to the side like that, straightens it out, that's when most of the pressure is going to be out here by the elbow. You can also prevent wrist extension by putting one of these cock-up braces on. And if you have a lot of pain in the morning, sometimes people sleep in a position like this at nighttime on their hand in like a flex position. And this cock-up splint, basically it has a hard bottom so you can't flex and extend your wrist. So these are the two main types of bracing for tennis elbow. One is to put the pressure here right below the lateral epicondyle. And the second way is to just stabilize the wrist so it can't do a lot of extension. One of the other things that you can do to decrease your symptoms of tennis elbow and sort of avoid to, a lot of times you can avoid to get it in the first place, is by building up the handles that you use a lot. And that makes easier for you to grip the hammer so you're not putting as much pressure through those lateral tendons. The first sort of order of treatment would just be some ice in the area. You can either take an ice pack and just put that around the area, or I find that what works really well is just to get a couple ice cubes, and you could take your other arm and just put your hand over it and rub the ice cubes up and down. And while you're doing that, you can just move your wrist up and down a little bit. And just do that for about 3 to 5 minutes until your elbow feels like it's pretty numb. If you're going to put the ice on like this, usually about 10 to 20 minutes. One of the other things that works really well with tennis elbow is just trying to loosen up the tendons and the muscles in this area. Bring your hand up just a little bit more. And you could just move your wrist up and down while I'm going through this motion here, trying to loosen up the tendons. Another thing that I found fairly effective in treating tennis elbow is also moving your wrist in a rotary position while you're stretching, both into extension and then into flexion while you're taking it around and rotating the wrist. And then another very good exercise for tennis elbow is with your elbow completely straight, just moving your wrist up and down to end range. Initially, if it's painful, you can do it a little bit with your elbow bent, both sides. And then as it gets less painful, you can make sure that your elbow is completely straight, bringing your other hand over and just stretching it out in this manner for about 20 seconds. And you want to do that after your arm is warmed up. You can even do it before your work day or before you grab the tennis racket or pickleball racket to go out and play. So as your elbow starts to feel better and you're starting to slowly get back into your activity level and you're icing after each time that you play, in between those days you can do a little bit of wrist strengthening stuff. I would do more flexion activity than extension activity. Bring your other hand over to support. Don't put too tight of a grip on this, and just do some flexion. Now, I'm not going all the way up into full flexion. I'm just kind of staying in this neutral position. Just nice and easy to stretch out the tendons and to give you a little bit more arm strength. You can work both into flexion. This is called radial movement, radial deviation. And then you can turn your arm upside down a little bit and do ulnar deviation. And then sit up tall. Don't put too tight of a grip on the dumbbell, and just kind of take it back and forth. If any of these things start to cause you pain, then you have to back off a little bit. Now, this isn't an all-inclusive treatment for tennis elbow. If your tennis elbow really starts to get bad, I suggest you go see an orthopedic doctor, perhaps get some x-rays on it, talk to him about it, and see exactly if it's really painful, exactly what's going on. Most of the times, a tennis elbow does not require surgery. If it's chronic enough, sometimes the doctors will do some cortisone treatments in that area.
Thanks for watching, guys. I hope you learned something. If you have any questions or comments, leave them down below, and I will see you in the next one.